Hello, I'm Dr. Lisa Chong, and I'm a TMJ and tongue tie specialist in Sydney. Welcome. Today we'll be talking about sleep apnea. What does sleep apnea cause has something to do with TMJ dysfunction. Sleep apnea is a problem where people cannot breathe and they're waking up repetitively. And the reason why they are not breathing is because, number one, there is an airway obstruction. The airway obstruction can come from the upper airway, which is a nasal passage, or the lower passage, which is around this throat region. Now, how can someone get airway obstruction? Well, you have to find out the cause of the problem. Have you got an airway obstruction because you have a nasal septal problem, which is like the bony aspect of it? Have you got a narrow palate, which is really narrow, and this picture will show that? And have you got any issues with the tongue flopping back and obstruction in that area? Have you got an enlarged tonsils or adenoids? Have you got any obstruction from this pharyngeal region where you need to see an ENT for that? Or you've just had a lot of fat deposits around here which collapses back when you're sleeping. So all of this can contribute to a sleep apnea. So what is the relationship between sleep apnea to TMJ dysfunction? When you're actually having sleep apnea issues, your survival instinct kicks in when you're sleeping. Your jaw posture forward like so, and you're constantly doing grinding issue at night just because you need to breathe. So your brain is saying, I need oxygen, I need to breathe. So your jaw is clenching constantly at night just to allow your airway to open up and allow you to breathe and take oxygen in. So it's a very clever system. You're not gonna sort of let yourself pass out or die because you don't have enough oxygen. So you're clenching to do that. So if you notice that your dentist is telling you that your teeth has been worn down, they're very short and they're flattened, or you notice that some parts of your enamel is worn down and you have that crescent shape feature, which is on this diagram here, adfraction, where the neck of the tooth is worn down and it's very sensitive when you drink cold water, such as this diagram here. And if you notice that your teeth are very flat, such as this diagram here, you have to ask your doctor and say, am I grinding my teeth? So there are solutions for that. Number one, go to a GP or go to your dentist and ask for a referral to seek for a sleep study. Number two, ask your dentist to make you an orthotics or splint if you're grinding your teeth, and make sure that the orthotics is actually made to posture your jaw forward if you are diagnosed with a sleep apnea problem. If you are diagnosed with sleep apnea problem, make sure that you know the severity of your sleep apnea condition. If it's not so severe and it's moderate, you can still use that mouth guard to posture your jaw forward to take in the oxygen. If it's severe, you might need a combination of a CPAP machine as well as the mouth guard. So you need to know the severity of how advanced your sleep obstruction is. And thirdly, you need to also see if there are some contributions, such as like if you're not able to breathe at night, why is that so? Are you allergic to your pet's hair? If you're allergic to your pet's hair, try and sort of like avoid having pets into your bedroom, or wash your linens and do all sorts of cleaning up just to ensure that you don't have that dander on your pillowcases and your linens. Number two, eliminate any sort of allergies and hay fever that could contribute towards clogging up your airway, your sinuses. If they're dripping constantly, you need to perhaps take some decongestant or do some nasal clearing exercises before you go to sleep. So this is a nasal clearing exercises I'll teach you this video. You pinch your nose, you shake your head, you do this for 2 to 5 minutes to clear your nose before you go to bed. So that's it for today. Nasal clearing exercises. I look forward to seeing you for your next session. Thank you.